Health and Wellness Myths and Facts. I'm Ambika Singh Kama. The term heart disease refers to several types of heart conditions. While most of these conditions are preventable, heart disease is the leading cause of death in both men and women globally. Indians develop heart disease 10 years earlier than those in Western countries, and nearly 3 million individuals die from stroke and heart attack each year. The most worrying part is that among the heart attacks, 40% are below the age of 55. In young Indians, higher rates of heart diseases are due to both inherited genes and environmental factors. Unfortunately, these environmental factors have only worsened the risk over time. Stressful jobs and working long hours have become the new norm in our lives. Even a lack of physical activity and eating a lot of processed foods have contributed to increased heart disease risk. The COVID pandemic has exacerbated the cardiovascular disease burden. When people are informed about the risk factors, they can take precautions or manage their symptoms at the earliest and reduce the risk of a heart attack, heart failure, stroke, or sudden cardiac arrest. We have experts with us to give us the correct guidance about heart disease prevention and management. So if you have any questions you would like to ask, then please send them to us via WhatsApp. The number is +91 9167 666 941. That is the number to send us your questions for our experts. Do also please send in your name and your location. Let me introduce our experts. We have with us Dr. Tiny Nair, Head Department of Cardiology at PRS Hospital, Trivandrum; Dr. Aniruddha Chandorkar, Consultant Interventional Cardiologist, Arogya Clinic, Ruby Hall Clinic, Pune; and Dr. Professor Saumitra Ray, Director, Invasive Cardiology, AMRI, Dhakuria, Kolkata. Thank you all so much, doctors, for joining us today. I would like to start with you here, Dr. Nair, first, that many people suffered from various heart complications post-Delta variant recovery. Do you think it will be the same after Omicron recovery, and also do you recommend people to go for a precautionary heart checkup?
Thank you for that question. Now, Delta is a nasty virus. The Delta variant of COVID is a nasty virus. It just goes and affects the lungs and sets up infection, what we call as pneumonia. And everyone knows that pneumonia is bad news. But that's not all. This Delta variant of COVID goes and affects the inside lining of our blood vessels, what we call as endothelium. See, our blood vessels are lined with a very thin layer, which is called endothelium, that prevents blood clotting. Now, this Delta goes and affects the endothelium and creates a milieu where we get clots in various organs, clotting in the brain, stroke, clotting in the heart attack, clotting in the lungs, pulmonary embolism, clotting in the veins. Now, fortunately, Omicron is different. The Omicron variant does not go to the lungs at all. It tends to set up home in the upper respiratory tract. So the patient has cough, he has got sore throat, he feels bad, but pneumonia is exceedingly rare. Not just that, Omicron's ability to damage the endothelium seems to be very, very little. So this clot kind of stuff is much rare. So generally speaking, from the cardiac point of view, Omicron looks much milder and much, much safer. That's point number one. Precautions is same for every kind of COVID.
Sure. Actually, I think like you rightly said, it's fortunately Omicron is not really reaching the lungs, so it's much better. But yes, we still need to take precautions. Moving on, Dr. Chandorkar, we have seen that even healthy and fit individuals have passed away with sudden cardiac death. Can stress be one of the hidden causes of sudden cardiac death? What is your view on this?
Sudden cardiac death is a killer. It affects usually younger people between the age of say 30 to 50. Men are more predisposed to getting affected by sudden cardiac death compared to women by a factor of 2 to 1. Unfortunately, many of them are caused by arrhythmias, rhythm disorder. So the heart goes into a very rapid, very irregular kind of heart rhythm, which seizes the effective blood flow to the entire body, including the lungs and the heart itself. And as a result, this can lead to a sudden death. Now, if not diagnosed in time, this will lead to a fatality. However, if there are adequate education, public education happening, and if people have screened themselves for finding out if they are at risk, then these lives can be saved. If you start working on these people who are suffering, the victims, early enough, you can save as many as 90% of lives. Every minute of delay, however, will lead to a reduction in survival of about 10% per minute. So it's a killer. We can screen them and we can save them.
I think that's a very important point. It is a killer, but we need to screen them well in time. Dr. Ray, again, we've spoken about heart and how screening is important. Tell us, can heart failure occur in young people, and what are the consequences of not availing timely treatment for heart failure?
Yes, heart failure can occur in younger people. As a whole, India sees a younger population with heart failure compared to the Western population. By at least 10 years, our population younger when they are diagnosed for heart failure. But when you are talking about really young people, perhaps you are meaning people in their 20s and 30s. Yes, they may have heart failure. There are few reasons for that. Number one is the causes of heart failure occur very early in India, like high blood pressure, like diabetes, like obesity and inactivity, like smoking. So these things occur in younger people in India and then can lead to heart failure. Number two, as Dr. Nair has already said, that this Omicron variation or Delta variation particularly can cause any person affected, and that can cause heart failure at any age. But not only this COVID, there were myocarditis due to various viruses which usually affect the young people, young ladies, and who can go into heart failure in younger age. Another important cause, though it is receding in India, is rheumatic heart disease. When they have the joint inflammation, it affects usually the person in their teens or even earlier, and heart failure can manifest in early 20s or 30s. Though it is receding, but it's still prevalent in pockets of India, Bangladesh, Sri Lanka, etc. And lastly, I would say use of alcohol and certain drugs, particularly cannabis type of drugs, can lead to heart failure in younger people, and we have to be very cautious about those.
Okay, sure.
Unless you really be careful about the early diagnosis, this heart failure can lead damage to many other organs like your brain, like your kidneys, because of lack of chronic circulation and oxygen. So you need to be careful so that you don't get homebound with oxygen by the age you are 40.
And I think, like you rightly said, taking care and avoiding, not to, overlook any symptoms. Dr. Nair, the prevalence of cardiac arrest is increasing in the younger population. We were just discussing that. So tell us, does smoking cause cardiac arrest?
See, I think here people should understand the difference between cardiac arrest and heart attack. A cardiac arrest is the heart beats about 70 times a minute, right? And then it increases if we are angry, we are upset, it subsides, quietens down when we sleep. Now, if this suddenly stops beating effectively, it is a cardiac arrest. Okay. We call it arrhythmia. Okay, so the person suddenly falls down unconscious. That is cardiac arrest. In contrast, heart attack is where there's a blockage of the oxygen and blood supply to the heart. So a person gets a chest pain, he is rushed to the hospital, he sweats. That is what is heart attack. Now, heart attack can give rise to a cardiac arrest, but not all cardiac arrests result from heart attack, right? Now, let's talk about smoking. Smoking narrows down the arteries to the heart and can cause heart attack at a younger age. We all know that. And that may be one reason. But the other thing today we know is that nicotine, smoking, makes the heart more vulnerable to the cardiac arrhythmia, which we were talking about. So a young person smoking has a dual problem. One, reduction of blood circulation, he can have a myocardial ischemia. And the other side, he can have a sudden cardiac arrest because of these irregular heartbeats or a sudden cardiac arrest.
Okay, so smoking definitely is a big no-no either way. It affects both ways. Dr. Chandorkar, does sudden cardiac arrest mostly affect people with a history of heart problems?
Yes, indeed. In fact, 75 to 80% of people do have a background of previous heart disease, either valvular heart disease or ischemic heart disease, a previous heart attack, or a weakened heart due to any reason. COVID has induced a cardiomyopathy, as we have seen in the last 2 years. If the heart is weak, if the overall pumping efficacy is lower, so when we talk about heart weakness, we talk of a situation of left ventricular ejection fraction. So if the ejection fraction is down to 35 to 40%, there is a greater risk of getting sudden cardiac death. The pre-existing heart conditions may or may not be symptomatic. Now, in that situation, screening for pre-existing illness becomes all the more important. In fact, all cardiologists, no matter what they're doing, even if I'm doing an angioplasty to a population, I'll say, please find out if you have a risk of heart disease.
Yes.
You have a strong family history, you have a high cholesterol, you have a high sugar, you've been using the wrong substances, you don't exercise at all, you overeat, you don't sleep well, there's too much stress, and you'll end up with heart disease at a young age. As you said in the preamble, Indians tend to get heart disease about 2 to 3 decades before the Caucasian
Yes.
counterparts. And that's terrible. It's been said that Indians lose people under the age of 30 to the tune of 4 jumbo jet fulls every single day. And that is a very, very frightening statistic that the population needs to be aware of. We are
Absolutely.
losing something like 4 to 5 lakh young Indians below the age of 30 of heart attacks or sudden cardiac death.
Yeah, I think that's a very important point. And I think also what you said, that there are so many factors responsible, along with, whether it's family history, whether it's if you're not sleeping well, exercising. So I think that's really put it out there. And awareness, of course, is key. Dr. Ray, is sudden cardiac arrest caused by heart failure? And are these two conditions different from each other? Can we know the symptoms of cardiac arrest?
Yeah, thank you. No, they are not same conditions, but they may be interrelated. I'll give you an example to make it a bit simple. See, if you think heart as a house, then the walls of the house are cardiac muscles. And when the walls get weak, say because of aging, because of paste, because of damping, then it is heart failure. So the muscles are weak, they are not pumping properly. And what is cardiac arrest, as Dr. Nair has explained, that it is an electrical problem. So if the electrical wiring of the house goes out of hand, either there is a snapping, or there is a voltage fluctuation, or there is a short circuit, then the whole house goes dark. And so the house goes dark means the heart has got no electricity, so it cannot do it work. It cannot do the pumping. And if the pumping is off, then immediately the circulation is arrested in the body and your brain doesn't get any blood. So the person gets unconscious, he falls with a bang, and that is cardiac arrest. So they may be related, because you said electrical wiring goes to the house walls.
Yes.
If the wall is damp, then the electrical wire may be damaged as well. So they are related, but they are not exactly same. So, but how do you know that there is a cardiac arrest? Yes, of course, there is no symptom of cardiac arrest. What happens is the patient is just leading a normal life, say maybe talking to you, maybe dining with you, maybe having a holiday, maybe doing work in the office, and just a bang, he gives a shout and he slams on the floor. His eyes get stiff and rolled up. There is frothing at the mouth. His whole body gets stiffened. There could be a little passage of urine, and he is not with us anymore. So unless you do an extremely emergent management of this person, it is very difficult to recover. Every second counts.
Every second
If you
counts.
lose a few seconds, then the damage, even if the patient recovers, the brain damage becomes irreversible and it leaves as a vegetable. So that is very important to recognize on the street that this patient is having a cardiac arrest.
I think recognizing, and what you rightly said, that every second counts. On that note, we're going to be taking a really short break. We'll be right back and the discussion will continue. Welcome back. You're watching Health and Wellness Myths versus Facts. Dr. Nair, is there anything a bystander can do to really help save a life threatened by a sudden cardiac arrest? We were talking that in case, situation arises, time really matters, every second counts. What are your thoughts on that, Dr. Nair?
I think this is the most important question here. Let's say you or me, we are taking a stroll in the park or sitting in the railway station. We suddenly see, like Dr. Ray said, somebody collapses, falls down. So what do? It might be a cardiac arrest. The first thing we do is go and shout for help. Ask everyone that, oh my God, somebody has collapsed. Ask for help is number one. Number two, try to shake that person and ask him, are you all right? See, it may be simple fainting and we might be overreacting, right? So if he answers, we know that it's not cardiac arrest, he is still conscious and he has fainted. But if he is not answering, step 3 is check for his breathing and pulse. Now, if he is not breathing, let's say he's not breathing and he has no pulse, that means it's a genuine cardiac arrest. And without wasting any time, we should institute what we call as cardiopulmonary resuscitation. What does it mean? We compress the victim's chest artificially to pump his heart. Right. And we tried for some time, and if he is not responding, the next step is we deliver an electric shock to start his heart, kind of start back his heart. And that is done with an instrument called defibrillator. You have seen that, in railway stations, in airports, in shopping malls, you see those yellow-orange instrument called AED. It's an automatic electrical defibrillator. It gives a voice prompt as to what you should do step by step. But you need a training in a CPR and how to handle an electrical defibrillator to do the job safely. So we say that every citizen, every adult, once you graduate from school, probably you should have a training in CPR, cardiopulmonary resuscitation, and how to handle an electrical defibrillator, automatic defibrillator, because that is likely to save someone and save his life, right? It may be anyone, our relative, our friends, anyone.
In fact, what you rightly said, a training in CPR will really be a help in saving lives. Dr. Chandorkar, what are the treatment options available to treat cardiac arrest, and can people live a normal life after surviving a cardiac arrest?
See, as Dr. Nair said, if you have sensitized enough people and you have had an early response to the crisis, and hopefully the man or woman has survived that arrest and gone to the hospital, then we are in a situation to start thinking of what next. So we have to come to a complete diagnosis. Typically, we look at electrolyte abnormalities, we look at the pumping of the heart, we look at other structural abnormalities. There are various situations like dilated cardiomyopathy, there is hypertrophic cardiomyopathy, there is ischemic cardiomyopathy. So depending on the cause, we work that up. The second thing we have to do is find out what is the electrical cause of the problem, which means is there something like an abnormal electrical pathway, the conduction is abnormal, or there is an abnormal focus within the heart, either in the upper chamber, more usually in the lower chamber, what we call the ventricles, which is giving rise to an arrhythmia, a rhythm disorder of its own, which leads to a risk to the life. If we have done the complete workup, which means diagnosis, then the treatment may take form of medication, or if there is a propensity towards dangerous ventricular arrhythmias, like Dr. Nair was talking of a defibrillator, we do have devices which can be implanted within the patient's body, which crudely one can say look like a pacemaker, but it is much more sophisticated.
Okay.
And they can sense dangerous rhythm disorders and treat appropriately in time to save the man's life within a matter of a few seconds. So there is an algorithm which is built in. All the diagnostic algorithm is gone through. If the dangerous rhythm disorder is diagnosed, it is treated. So you are kind of done before the patient virtually loses consciousness. The man is back in a conscious state. So that's a very important advance which we have been using for the last 3-4 decades.
Yeah, I think that's some very important points which you've shared. And again, like you said, the way to use it and save lives, of course, time again is key here. Dr. Ray, can high intensity exercise acutely increase the risk for sudden cardiac arrest or sudden cardiac death in individuals with no prior history of heart disease? Because we see that is pretty common now. A person was exercising and, later we hear that they've, had a heart attack or a cardiac arrest.
Very interesting. I don't want the nation to go away from exercise.
Yes.
I don't send you a wrong signal. But certain people must be cautious before embarking on heavy exercise, physical exercise, or so to say, body contact games. The first and foremost caution is there a family history of sudden cardiac death? Any young relative in this family had suddenly died while playing football or while running to catch a train. If this is there, you have to be on your guard. Be absolutely careful. Then the risk factor. like the drug abuse, alcohol, smoking, obese person, high blood pressure, diabetes, very high tension job, those people should be cautious before embarking on a high intensity exercise. And in Western world, in Europe and America, before you can join a high intensity training or so to say play like football, rugby, you have to go through certain physical testing by a doctor or by a physiotherapist, etc. Here, because of lack of infrastructure, we cannot afford to do that. But you often hear that a young person of 18, 19, 20 years boy is just gone for a football practice and died on the field. Or a young IT professional just having a treadmill test during the lunch break in his office is just snapping on the treadmill and dying. So these are hidden. They didn't have any history of heart disease before. But if perhaps there was background which was missed. So in these backgrounds are clearly denoted, there should be guideline to the public and they should have at least an ECG and a physical checkup by a trained personnel, maybe a physiotherapist, maybe a sports medicine person or a general physician before they can go on to a high intensity training program.
So better to be cautious, and like you, I think what you rightly said, of course, exercise is important, but really knowing what your body takes and what your body can actually do. Dr. Nair, also tell us about the environmental pollutants, how they affect the development and progression of heart disease.
All these years, you see, we were talking about environmental pollution relating to lung disease. Okay, so if you stay in a city like Delhi or Beijing, where there's a lot of pollution, you might end up getting asthma or bronchitis, you can go on coughing and all that. But today we know that we were wrong. If we consider those very small particles as a pollutant, which are kind of less than 2.5 microns in size, we call them PM 2.5, they tend to seep through the lungs, get into our capillaries and circulate and create heart disease. Now, it's clearly known that environmental pollution can give rise to heart disease. Now, there are three things to remember. One, it depends on the quantity of pollution. So if you are kind of remaining in a smaller town, probably your exposure is much, much lesser compared to a city like Mumbai or Delhi. Second, the duration of stay. Say you visit Mumbai once a week versus I stay right in the center of Mumbai for years together. So the duration of exposure is the second important thing. And finally, whether you have some kind of background, for example, high blood pressure, diabetes, already you have a heart disease. Such people are far more likely to develop a cardiac problem on exposure to environmental pollution. So environmental pollution is important. And this is something where we can do only if we join hands together, right? It's unlike diabetes that I suffer from. We have to join together to see that we are living in a less polluted world.
Yes, I think that's the most important point. Of course, you've showed the connect between, how it affects not only the lungs, but it's affecting the heart as well. But I think we can only do this together. Thank you so much, doctors, for joining us today and help us understand about heart diseases and how it impacts each one of us. Thank you so much for watching. News will continue on the other side.